listeners and viewers, depending on where you are joining us from, welcome on FOAPS TV and welcome on your great show all about FOAPS. Today, we are having a wonderful guest in our midst. When we'll be back, we are going to introduce him and present the topic of our discussion. Dear listeners and viewers, we started with all about FOAPs. And today we are going to know more about activities and partners of FOAPs. And the one and only that is going to entertain us on this very much topic is none than the Permanent Secretary of FOAPs. He is Mr. Alain KOFI KUMODZI. You are welcome.
Thank you, Dede.
Thank you very much for accepting our invitation to be part of us today. We heard so much about FOAPs, and today we would like to learn more about the main activities that FOAPs is having. So, when talking about activities, it means that there are countries in which FOAPs operate. Can you please enlighten us on the countries in which FOAPs operate?
Thank you. Thank you for inviting me for this discussion. It's a privilege, and I hope that I'm going to be to meet your expectations. That said, FOAPS is, as we said, West African Private Healthcare Federation, meaning that basically, geographically, we are in West Africa. Now, countries that have been able to create their country federation or platforms or alliances and have joined FOAPS as of today, 10 countries: Benin, Burkina Faso, Côte d'Ivoire, Mali, Ghana, Liberia, Niger, Nigeria, Senegal, and Togo. I hope I haven't forgotten anyone. We are still working with 5 other countries: Gambia, Cape Verde, Guinea, Guinea-Bissau, and Sierra Leone. Sierra Leone is almost done. Maybe next week we are going to have a meeting with them. So we are working towards giving them the accreditation to join FOAPS. So this is the situation as it is now.
Wow, FOAPS is operating in so many countries across Africa. And this is a very wonderful initiative. So I would like to know, what are the main activities of FOAPS?
Okay. When we go back to the vision and the mission, you realize last time when we met, we discussed about that. And I mentioned the fact that we are working toward improving public-private dialogue in a way that will strengthen the achievement of universal health coverage. So basically, this is the vision, these are the mission. How do we achieve that as FOAPS? First, we want to be a united voice. First, we want to advocate. First, we want to promote more understanding from the public sector in regard to how the private sector is contributing to the achievement to their health agenda. To do that, we, the Permanent Secretariat, have been instructed or entrusted by the board under the General Assembly to conduct a series of activities that are considered critical to go there. The first kind of activity we need to mention is that we are working towards the strengthening of our federation, the regional federation, as an institution, as a body that has this ambition, and how do they need to strengthen their own capacity to reach there. We are doing the same thing in regard to every country federation. So it means strengthening their capacity in terms of organizational development, how the various bodies operate interdependently, to respect their own constitutions, rules and procedures, etc., etc. Of course, an organization like a federation in our country cannot exist if they are not interesting for their members. Last time I told you that our members are the country federation when we talk about FOASPS. But when you go to a country, every country federation accepts as members individual or institutions, firms, companies that are operating in the health sector as private. So how do you do to make sure that all these members find an interest to be part of it, to continue to contribute? If you are able to do that, then it becomes easy for them to pay their dues, their contributions to the organization. So the first thing is to make your organization interesting for its members. We are working towards developing the capacity of our country federation to do that. Then, of course, after mobilizing your internal resources, your contribution, your dues, etc., you need to mobilize more funds externally towards your partnership. So it means that you have to be capable of developing the partnerships, promoting your vision, your ideas, your activities, so that some of those partners can support financially, technically, etc. So those are some of the things. Of course, when we are doing that, it means that we at the Permanent Secretariat, we have that capacity to strengthen others. We are doing it internally. So it means that we also have that capacity to do it externally, meaning that we are offering our services under the department that we call right now FOASPS services. FOASPS services promote capacity building services, okay, mean training, organization of retreats, organization of advisory services, coaching and mentoring, etc., etc. So those are paid services that we offer to others. And we have some partners or some clients who give us this authority and pay for those services. FOASPS, as I said, is also working in that avenue of advocacy and communication. For instance, putting in place a media like this, FOASPS television, is part of that idea of advocacy and communication, right? We are developing also our capacity to become a major high-level policy conferences in our region. We want to become a recognized organization for that. We have started in July 2023. We organized a high-level policy conference in Abidjan. Okay? We are preparing to organize another one next November, still in Abidjan. And in 2025, we are going to have another one in Accra. So when we are talking about the high-level policy conference, it means that participants are high-level personalities, ministers, leaders of international institutions in our region, and their partners, of course. So those people come and meet with us. With, of course, participants from our own country federations, meaning our own countries, etc., etc. In Abidjan, we were 300 participants.
That's a lot.
Yeah. And for 3 days, we discussed about how to improve the public-private dialogue towards the improvement of universal health coverage. So just to give you an idea of the kind of things that we are able to do and that we are doing.
Such interesting activities. You promote private-public dialogue. You also help in, you talked about the second item you talked about is about, can you just recall it?
Advocacy and communication.
Advocacy and communication. Those are powerful tools because one cannot, talk about private public dialogue without talking about communication, without talking about advocacy. And if these private and public dialogue should be there, then we should lay emphasis on communication, advocacy. So thank you very much for those brilliant initiatives. So I would like to know, of course, you mentioned the activities. So it means that there must be challenges. Can you talk about it?
Yeah. The challenges are, I will start with the fact that being a new organization, because we've been created only in 2016, we are coming from far in a situation where the public sector leaders did not really recognize the private sector as important in the health system. Now things are changing slowly, but situations are not the same. In some countries, our country federation are really very much understood and embedded in the discussion that are going on for defining the policies, the strategies, etc., etc. In some countries, we don't have that same situation. So when, as the regional umbrella organization, you have to provide support to those kind of countries, you realize that you cannot put in place a tool that will work for everybody. You have to adapt from one country to the other, etc. So this is something that is really challenging for the Permanent Secretariat and for the board, of course. That said, we can also mention the financial resources, because when you want to do all the description that I've just given, you realize that you need some resources to be able to do that. The good news is that we are trying to challenge that challenge by using our capacity at the regional level as well as the capacity in our country federations. Meaning that, yes, we have a team for the Permanent Secretariat of FOASPS, but we also work with colleagues at the country, at the national or country federations level. So those are how we can manage some of those challenges. The last challenge we have is due to the high level of our constituencies, our members, they don't have time because they are working in a sector where they call their clients patients, but they are not patient because when you receive a client, it is something that is emerging. You have to find solution immediately. So therefore, sometimes you have an appointment with one of these board members, and at the time of the meeting, they are not available. Okay, so it becomes really challenging. And sometimes also even reaching their emails to be able to know what is going on in the system is tricky. Because you send an email, you believe that they have read it, but they haven't. So the return we are expecting is not coming. So those are some of the challenges we are experiencing and we are trying to adapt.
So we are calling on all donors and sponsors out there to support this great initiative. I mean, we cannot talk about, bridging the gap between the private and the public sector when it comes to health without you out there supporting this great initiative. So this brings me to the next question. What are the prospects?
You mean our client?
No,
No?
I'm talking about the outlook in the future.
Okay.
What do you intend to do?
Okay. In the future, let me say that we are positive. We are really positive because when you look back and when you see what we have been able to achieve in less than 2 years, we are really positive. Personally, at my position of permanent secretary, I am confident that I have a team, dedicated people, very convinced, engaged, and they are giving the maximum of their capacity. So, and we are working remotely. I told you last time we talked about this, but then everybody is bringing in his intellectual resources, capacity to take initiative, capacity to suggest project solutions when we are facing a challenge. You receive contribution from your colleagues, and you really feel proud and encouraged to continue. We also have a board that is very, very dedicated to the mission and the vision of FOASPS, and that gives the total confidence, the total trust to the permanent secretariat. So we are working hand in hand, and we are achieving a lot. So our expectation is that in the next, let me say, 2 years or so, we will be able to push and to start some of the concrete activities, some of the concrete actions that we plan in our strategic sustainability plan, meaning that we want to create the conditions for FOASPS to be sustainable, to be able to have enough sources to mobilize resources, okay? So that we are not afraid of recruiting more capacity, recruiting more people to give more to the sector. So personally, I'm really confident, and yeah.
I love your confidence. I love it. In fact, you know, there is this say, together we stand, divided we fall. And I just love the way he said that we have people that are committed, that are devoted for this project. So I'll just say congratulations
Thank
because
you.
this is a wonderful initiative. I must congratulate the whole team, the board, and all the people that are involved in this. So this brings me to the next question. It means that if you are able to achieve all this, there are some partners behind. Do you have, you know, individual partners, institution partners? Do you have such?
This is a very good question. We have partners, and our partnership vision does not give a particular privilege to partners who are just bringing something or giving something to us. We are looking for partnership that put us in situation of working together with other organizations that share the same vision as us, that share the same mission, that are working towards creation of those conditions that I spoke about. So yes, we have partners, and if you give me the chance to talk about some of them, the first partner I will talk about will be USAID. USAID is our main partner, and I believe that we need to take a specific program to talk about what we are doing with USAID. I would just mention that the grant under which we are working now to be able to put in place a permanent secretariat is given to FOASPS by USAID. But I believe you need to have a special program to talk about that.
Of course, we will have another program for that.
Thank you. Now, we have another partner That is also very important, even though we are not receiving funds from them till now. I hope we will receive some later. But the West African Health Organization, WAHO. You know, WAHO is an ECOWAS institution that is being created to take care of a health agenda in West Africa. So therefore, being in partnership with WAHO is very much important for us, as it gives us the avenue to reach ECOWAS and all the other institutions. That gives us the chance to be now being a partner of WAHO. We are now accepted as an institution that is invited for the Ministers of Health Assembly that is held every year. So we are invited, we attended the first one recently in May in Abuja, where we sat in the partners meeting one day before the Ministers Assembly, and during the Ministers Assembly, we are observers. But that gives us the chance to meet with all these decision makers, interact with them, and share some of our concern. So for me, the partnership with WAHO is very, very important. Okay. Another partner I would like to mention is African Resource Center. This institution is being created by Bill and Melinda Gates Foundation to mobilize resources in Africa to promote the drug and medical materials supply chain. Okay, we are in this meeting with the International Pharmaceutical Forum. You realize how much drug is important to reach universal health coverage. Some countries, they are saying 60%. In Togo, they said it is 60% that the INAM, the Institution for Medical Insurance, is paying against 30% for the medical consultation and all that. So it is important. Having control, having a good system for the supply chain is critically important. So Bill and Melinda Gates Foundation created this institution, African Resource Center, that is working in the region. We are partners. We sign a partnership with them because we also want to work together towards the advocacy for these supply chain issues. We have a partnership with an African Federation of Textile Care Professionals. Okay, textile care professionals. Why? Because one of the main components of this association is to promote the security of patients through the quality of maintenance, the quality care for medical linen. You cannot imagine the number of diseases, the number of, or even people who die in hospital, not due to the disease that bring them to the hospital, but due to new diseases that they catch when they were in the hospital. And some of the aspects or some of the reasons are the non-professional care for the medical linen. Okay? So this is something very important, and that is going to be more and more critical in the years to come. We foresee that already. So we want to work with FAPET, that is this professional organization, to advocate and promote a change of system for how we care for the medical linen. Okay. We also have a partnership with GSPS. GSPS is the groupement des services de santé de Madagascar. Madagascar, let me call it Federation to be in the same jargon, it is the Fédération of Private Sector of Madagascar. Okay, they call it Groupement du Secteur Privé de la Santé. Yeah. Groupement du Secteur Privé de la Santé, GSPS. We also have a partnership with them because they really ask for it. They are in, let me say, Eastern and Southern Africa, and they are surrounded by English-speaking countries. They don't have much French-speaking countries. So it becomes important at a point for them to have this kind of linkage with FOASPS because we have many Francophone countries here. We develop some tools, they also develop some tools. So we want to have this collaboration to learn from them and they will learn from us. Okay? So again, you will see that it is not all the partnerships that are for money, but though we like to have money, we also like to create conditions for working together with people who are like us, and we can share our experience.
Wow, such a long list of partners. Those who are financial partners and those who are technical partners, if you can call them like that.
Exactly.
So we say thank you to you all, USAID, WAHO, just to mention but a few. Thank you for the great work you are doing with FOASPS just to promote private and public dialogue in the health sector. So I have more questions for you. The next question is, can you mention some of the activities that you have with some partners?
Okay. I want to mention some of the activities, like again, as I said, with ARC and WAHO. We are working towards the creation of the health sector, let me say West African health sector mapping. It will be accompanied by a search engine that will allow anybody who want to reach out to a medical institution when we want specialized medical institution like cancer, Santé, for example. When you go to this search engine, you will be able to identify the various opportunities that are there. Okay? If you want to purchase some material, you can go to that search engine and you will see what is available and etc., etc. Whether in the region or even out of the region, but people who are commercing with our region in that particular area. So we are working towards that. And you see, being in partnership with both of them, it was interesting to see that the two of them are also in partnership. So we are working towards the creation of this engine as a three-party collaboration. Okay, we are working on that. We are working with FOASPS to also, we are working with WAHO, to also commission a survey of what is the contribution of the private sector right now in the region in regard to some specific areas of health. Okay? So those are some of the activities we are working on. I mentioned the high-level policy conference before. Of course, you will realize that you cannot organize this kind of huge event alone.
Yeah.
Okay? So we have some partners who interact with us, who supported this high-level policy conference. Of course, I've mentioned USAID. I should have mentioned World Bank as well, though they are not our, let me say, our permanent partner
main
per se,
main
partner per se. But for this particular high-level policy conference, they were partners because they also contributed to help the organization of this high-level policy conference last year. Today we have other partners. I don't want politically to be incorrect to mention some who promise, and if they hear on FOASPS television that I mentioned their name, though they haven't given yet, they will say no. So I will stop there for now.
Thank you very much. Thank you. So you mentioned ARC. I would like just to know, is it the African Risk Capacity or what is ARC?
ARC is African Resource Center.
Okay, okay.
If you allow me a little bit
Please
time
go
for
ahead.
that very quickly. The vision of ARC is to be able to mobilize human resources that are available in the region so that when we are strategizing for the supply chain, we don't import solutions from out of the region, but we base our analysis, our strategies on the intellectual capacity, the capacity of the resources that we have in the region. So their first mission is to be able to mobilize, to identify and mobilize the best capacities that we have in the supply chain.
Wonderful. Thank you for educating us on ARC. So, ladies and gentlemen, I'm very sure you really loved this information given about all about FOASPS. So this brings us to the end of the show all about FOASPS, activities and partners of FOASPS. So I would like to use this opportunity to say a very big thank you to the Permanent Secretary of FOASPS, Mr. Alain KOFI KUMODZI. Thank you so much for you being here with us.
It was a privilege to be here, and thanks again.
Thank you. Ladies and gentlemen, dear viewers and listeners, this brings us to the end of our show. Thank you for being with us. Thank you for joining us. See you later.